He has presented here several times. He is also a crowd pleaser. People love you. Okay, okay. I don't know. Some fun facts. He speaks Spanish, French, no Spanish, French. And he loves soccer. So give your attention to our next speaker.
Thank you all. So like Demetria said, my name's Chris. I'm currently working at Nebraska Medicine, so good to see some familiar faces in the crowd. I manage our retail pharmacies. We have 5 retail locations as well as our centralized services, so our central fill pharmacy. So lots of experience in the retail outpatient space. So going into this population health talk, this is something admittedly that's a bit new to me, and we've been able to establish a couple different teams amongst the teams that I oversee that really dabble in the space. So we'll go into some population health stuff today and look at some of the programs that we've started and how technicians really play an important role in promoting positive patient outcomes. So we'll go through our objectives. First, we're going to define population health, spend some time talking through just some of the ins and outs, go into some detail behind that. Look at guideline-directed medication therapy, making sure patients are on the right medication, but then more importantly, on the right medication, but more importantly, still taking the correct medication and being adherent to their medication regimen. And then we're going to understand the technician's role on that population health team. So first, just understanding what is population health. So we've got a couple schools of thought here, public health versus population health. So public health is really broad. It looks at, population as a whole. Lots of research goes into it, lots of health education, looking at, policy reform for the overall general public. Population health, while there are a lot of overlapping similarities, really focuses on outcomes for a specific group of individuals. And so we're looking at communities, we're looking at, subgroups of patients that have specific disease states, patients that are on certain medications. Really the goal here is to distribute those positive outcomes throughout that group to make sure that our patients are staying as healthy as they can be. They're staying out of the hospital, reducing healthcare costs, all those good things. But really it's a collective effort. And I think as we go through some of these slides, we'll really see how it's a team-focused mentality. There's, pharmacy certainly plays an important role in this, but there certainly are other members of the healthcare team that play an equally important role. So looking at some of the benefits of population health, I've got a list here of 6 of them, certainly not all inclusive. But we'll start with that first one. So better health outcomes, very vague. I know that just really encompasses everything, but from a population health standpoint, how can we promote positive health outcomes and better outcomes for our patients? Really looking at, a subset of or a group of patients allows us to focus on root causes. We're able to get down to specific reasons why there are healthcare issues. And when we apply that over a group of patients, we generally will see trends in a positive direction. Lowering healthcare costs. This is something that obviously everyone is trying to do, lowering those costs, increasing access. We just heard Dr. Klepser talking through a bunch of those things, so I'm not going to reinvent the wheel there. We all know the importance of that. Improve care transitions. This is a big one. Like I mentioned before, population health really is focused on that team mentality. And so we have, pharmacists, we have technicians, providers, nurses, social workers, all really working together with a common goal of having that patient be the center of their focus. And so when we have patients who are able to see this group of experts, when they transition from one phase of care to the next, that transition is much more seamless. Again, it just promotes better outcomes. Patient engagement kind of goes without saying, really engaging with your patients from a technician perspective, being able to perform outreach and things to patients to provide education, from pharmacists providing counseling, really empowering a patient to, be their own advocate when it comes to their healthcare, and, challenging them to make good choices, stick to their medication regimens, but really, giving them the onus to be part of their own healthcare journey. Proactive health management. And so really the goal of population health is to prevent things from happening, which is easier said than done. But a lot of what we do in the pharmacy certainly helps promote that. But really the goal, we want to keep patients out of the hospital, right? We don't want them sick. We don't want them, increasing our healthcare costs and things because they're going to the hospital. And so if there's things that we can do through identifying different trends or different things across a community, then we're better able to make informed decisions that are going to help us promote positive outcomes. And then finally, awareness of social determinants of health. And so this is an interesting one, as it's non-medical things that really contribute to someone's overall health. And so we'll look at this, but what is someone's socioeconomic status? How does that play into their health? Their level of education, all of these things that really, they're separate from being able to see a provider or having access to the care. But, what do those things look like, and how do they impact someone's health? And so these 5 things here, these are what I, in my opinion, are kind of the pillars of population health. So we talked about that group focus, and we're looking at a specific subset of patients, but really taking that and looking at that bigger picture. What are we trying to accomplish for this group of patients? If it's diabetic patients, the goal, we want to reduce that A1C and keep patients out of the emergency room for some sort of, hypoglycemic event or something. And so really taking a step back and seeing, what can we do to impact the bigger group? Population health is very, very data driven. There are a lot of performance metrics, a lot of different measures and things that we go over. And this is really, truly what helps us identify all of these trends and make those informed decisions. I mentioned already that it is interdisciplinary. This is where, pharmacists and pharmacy technicians certainly play a very important role in this. And I think when we go through, I'll talk in a few slides here on that interdisciplinary team. And when we get into the roles of a technician, I really want to focus on the technician specifically. I think a lot of times when we think of the interdisciplinary team, we think of the doctor, the nurse, the pharmacist, the social worker. We don't think about the technician, and that should not be the case, because you guys do arguably more than what everyone else does. And we'll see that. And I want to make sure that you guys are fully aware of that. And then proactive prevention and promotion, again, identifying trends so that we can make informed decisions to keep patients out of the hospital or keep them healthy before any sort of healthcare issue were to escalate. So looking at the group focus, the general question that we like to ask is, how does following a group of patients with similar health conditions prove to be beneficial to the community? Again, improved health outcomes, but it's that systemic change that we're really able to see. It's identifying those root causes of a healthcare issue and then advocating for those patients, advocating for policy decisions that will impact everything that goes on with that patient. I think this image here really does a good job of illustrating that. We know not all patients within a community are the same. Looking at those puzzle pieces there, they're not all the same, but putting them together represents that community and that cohesive unit. And that's what we're going for here. We're trying to identify that common ground amongst all of those patients. And again, touching base on those social determinants of health. So again, these are those non-medical factors that influence someone's health outcome. So economic stability. What is the economic status of that community? Are we talking about a rural community? Are we talking about, an urban area? I won't, again, go through what Dr. Klepser just talked about, but those counties that don't have pharmacies, how do we expect a patient to, be able to get access to their medications and things? Education access and quality, kind of the same story there. healthcare access. We'll talk on the next slide here, looking at, telehealth and seeing how that's really helped to improve access to healthcare. And then neighborhood environment, along with our social and community context. So what does someone's environment look like? Are they employed? Do they have the means to really provide the care that's needed for them? What's their support system look like? Do they have family members that can support them? There's all these different things that really play into it, much more so than simply taking a medication or visiting your doctor's office. And so looking at the bigger picture from a patient engagement perspective, so how has digital health or telehealth improved access? Well, obviously, we're reducing barriers in time and travel constraints. Again, I'm coming from Omaha, relatively decent sized urban area, but outside of that, it's pretty rural. And so not having the direct access to a pharmacy or to a hospital or a provider's office is really a challenge for a lot of patients. And so if you have the means to turn your computer on and do a telehealth visit, great, all the more power to you. That's more access to you, to your provider, to your pharmacist, to your technician, really to increase that communication, all the education, all the counseling and everything. This last bullet point here shouldn't come as any sort of surprise at all. But there was a study done that demonstrated statistically significant reductions in hemoglobin A1C in diabetic patients using telehealth compared to patients with no visit. I mean, that's kind of a no-brainer, but when you think of it, these are probably patients that didn't have access to their provider, ready access to their provider, and with the advent of telehealth, they're able to. And so we talk about data a lot when it comes to population health. And so here's just some examples of some of the things that we look at. So we got mortality rates, life expectancy, prevalence of disease, got those social determinants of health again, access to healthcare, healthcare utilization, and then data on preventative care. All of this, again, with that goal of painting that overall picture of that population's health. And so I pulled this image, just found it online here, but it's just an example of a way that we monitor this data. This is a diabetic patient analysis here. And so it looks at things, patient age, average A1C level, their BMI, and average glucose. And these are the types of things that over time, as we're able to track these, we can start making inferences about that population and make informed decisions on what we need to do to care for those patients. So the interdisciplinary approach, again, I already touched on this a bit, but you can see that in this graphic here, we have the healthcare team with that patient right in the center, and they're always the focus. Of course, that's what we do. That's what we're here to do, is to care for our patients. And so this type of approach certainly does lend to more of that patient-centered that patient-centered focus. It allows for more collaboration and really that holistic approach. So rather than, I know we just talked about, or you guys just heard a lot about fee-for-service versus value-based care. In this case here, we are using that value-based care approach here, and it's not fee-for-service where the physician is billing for every test, every procedure, every treatment. It's a collaboration amongst everyone. So some of the advantages of that, it allows us to understand the roles on the team and that everyone has their important skill set. Me as a pharmacist, I'm not trained to do nursing work or social care work or the work that a prescriber or a physician would do. But on the team, I can rely on their expertise and they can rely on my expertise to make sure that we're doing everything that we can to take care of that patient. It allows for effective communication. Allows for more collaboration. Really, the common goal in all of this is that we have a clear vision on what is needed to take care of that patient. We incorporate team culture and camaraderie here. I think it goes without saying, teams that work well together will certainly take care of patients better together. And then we can always learn from each other. There's always that chance to learn something new and something that we should never stop doing. And so along the lines with interdisciplinary, kind of getting away from the traditional healthcare professional role, we have our ACOs, or our accountable care organizations, and this has been a pretty big shift in the trend in population health lately. But an ACO is a group of healthcare specialists that work together on the overall care for a group of patients. And so it's coordinated care, it's monitoring patient progress, ensuring that patients receive the right care at the right time. But there's accountability behind this. So there's accountability for the quality of the care that's being provided, and there's incentives for providing good care or having good performance. Things are further incentivized to reduce healthcare costs through disease management with a focus on prevention. And then there's those shared savings through programs that would deliver efficient care. And so while this doesn't necessarily tie specifically back to pharmacy, it does tie back to the overall population health goal in reducing those healthcare costs, increasing that access to care, but not just access, increasing access to good quality care. And so how does an ACO work? Lots of communication. Like I said before, lots of coordination of care. There's lots of tracking and analyzing of performance. So here's where that data-driven mindset comes in. Again, goal of improving that quality of the care and reducing costs. So a lot of these ACOs partner with different organizations, and I have an example here from my organization. So we've partnered with our ACO to kick off a population health team within our outpatient pharmacy. I'll share some more information on that in a bit, but we've been able to be pretty successful in some of our endeavors, especially from an adherence perspective. So they share, different information with us, and really we work in collaboration with them to guide those programmatic outcomes, making sure our patients are adherent to their medications, and that they're on the right therapies. And this is where we see a lot of pharmacists and a lot of technician involvement. And so we do have technicians that work directly on these teams that do, kind of a non-traditional role. When you think about, retail or community pharmacy, these are things that are a little bit different. So it provides additional opportunity. So then going back to our overall population health definition here. So we've got that proactive prevention and promotion. So one of the primary objectives of population health management is to support that preventative care. And so we're going to do that through assessing health risks. We're going to alleviate them before they escalate. Things like as simple as getting regular screenings, looking at your blood pressure, getting your cholesterol checked, cancer screenings when appropriate. Those types of things are all super, super important when it comes to proactive prevention. Vaccinations, kind of an interesting and concerning stat. According to the World Health Organization, about 3.5 to 5 million deaths are prevented, or vaccines prevent about 3.5 to 5 million deaths each year. And so with current trends and everything, I know we've got measles is all over the news right now, and so I think we can't underestimate the importance of vaccinations in preventing unnecessary health risks. And then finally, that education and counseling, allowing patients to take control of their health, feeling empowered to take that ownership over their health. And so we've seen some recent shifts in population health. I know we just heard another talk before this on rising healthcare costs, but here are some statistics from 2023, $4.9 trillion in national healthcare spending. That's a huge number. That's a 7.5% increase from 2022. We have an aging population now, so there's an increased demand for senior care services, lots of long-term care, home health. Focusing on mental health has been really huge in the last few years, last handful of years for sure. Really, there's that increased focus on individual and community behavioral health. And a lot of it really comes down to addressing those social determinants of health and how they affect that overall population. We've had the advent of technology, telehealth, of course, we talked about that, but things like smartwatches, phone applications. I mean, this watch here, I can track my steps, my sleep, my heart rate, my glucose, you name it, it can track it. And just about everyone has something smart, it seems, these days. And so the advent of that is certainly allowing us to, be able to monitor a lot of these things and take that into our own hands. And then again, the value-based care models and trying to have that movement away from that fee for service model and incentivizing providers to deliver that high quality care at a lower cost. And so taking all of that, I'm going to shift a little bit for the next, or for the rest of the slides really, and focus more on pharmacy and medications and how we have an impact from a population health perspective. And so we'll look at guideline directed medical therapy, or GDMT. So what is GDMT? And so this is a standardized approach to treatment, focusing on proven medications with the goal of reducing morbidity and mortality. And so we have evidence that shows this subset of medications works for this group of patients, and this is what we should use. So you can see this was first coined with regard to heart failure management. And so we know, ACE inhibitors, things like lisinopril, ARBs, losartan, your ARNIs, your Entrestos, beta blockers, all those types of things are certainly evidence-based and proven to work when it comes to reducing that morbidity and mortality in heart failure patients. And so why is this important from a population health perspective? I think we can look at the example of diabetes and heart disease here. So patients who have type 2 diabetes as well as cardiovascular disease. So around 33% of patients have some sort of ASCVD or atherosclerotic cardiovascular disease. That ASCVD is the leading cause of morbidity and mortality in patients with diabetes. The annual spend on patients with diabetes and cardiovascular disease is in excess of $37.3 billion. We have evidence that shows that our GLP-1 antagonists and our SGLT2 inhibitors work to reduce that risk of major cardiovascular disease by 10% over a period of 2 to 5 years. But despite that evidence, less than 30% of our type 2 diabetic patients are on an SGLT2 inhibitor. We have the evidence, it's right there, but less than 30% of our patients are on the correct therapies. And that's staggering to hear. It's interesting to hear, we have all this data, why aren't we using it? Lots of different reasons. I think getting patients on the right medications is certainly that first step, but where pharmacy can really have an impact is through adherence. I think adherence really plays a key role in a lot of, from a population health perspective, it plays a key role in a lot of those patient outcomes that we look at. And so when it comes to medication adherence, estimates demonstrate that over half the medications that are prescribed to patients with chronic diseases are not taken as directed. Non-adherence to medications contributes to 125,000 preventable deaths each year in the US. And additional medical appointments, emergency department visits, and hospitalizations contribute to an additional $300 billion in healthcare expenditures. And that's crazy when you think about it, just not taking a medication. I'll admit I'm my own worst patient. I have to set myself reminders and everything to make sure I take my medications. I preach it every day in the pharmacy. So I know it's a challenge, absolutely. But we are in a position as pharmacists and technicians where we can truly make that difference for those patients. So when it comes to population health, one of the things that we really try to monitor when it comes to adherence is that PDC, or that proportion of days covered. And so this is a measure of adherence that assesses the percentage of days that a patient had a medication over a specified period of time. The standard threshold, or the industry standard here, is 80%. So this is the level at which a medication is reasonably likely to achieve whatever clinical benefit it's supposed to. So we think of that 80% mark we just saw on the previous slide, around 50% of medications are not taken as directly. So what's causing that gap? So when we look at barriers that may exist to taking medications or taking them as directed, a lot of times patients simply forget. Like I said before, I'm my own worst patient. I sometimes forget to take mine. But education in this case is certainly the right way to go. Perception that medications are ineffective. Patients don't feel any different when they take their meds. You look at a statin medication for cholesterol, patients don't feel better when they take their statin. It's not like a pain medication where you get that relief after taking it. And so you go in and you take your statin over and over, day by day, and you don't feel any different. A lot of times that perception is it's just not working, so I'm just not going to take it. Side effects goes without saying. If it makes you feel bad, you're not going to take it. The number of medications patients take. I wish I knew off the top of my head. I don't know if anyone does, but the average number of meds that a patient takes, it's got to be at least 6, 7, I would assume. But when you think about it, you have patients that are on a ton of medications. You can understand why adherence may be very, very difficult. In the setting that I work in, we have a lot of transplant patients, and you get a patient who discharges on a new patient or new transplant patient. They're on 23, 24 medications for a long time, and that would be very, very difficult to manage, especially if you're on your own. And so it goes without saying that adherence is super, super important. Rising costs of medications, so financial difficulties, lack of insurance, limited access, all those things we all know. Medications are certainly expensive. Anyone who works in an outpatient or retail setting can probably appreciate the work that goes into getting prior authorizations and things done. How many of you have worked in that type of setting where a patient comes to the counter and they have an Eliquis that might be $500 and they can't afford it, so they walk away and they don't get it? It's a problem, and it's something that needs to be addressed. I don't have all the answers certainly, but it is a big issue. Yeah. Mhm.
Some of the companies have copay cards.
Yeah.
And it was 0, they maybe up to 10 or $15 a copay.
Mm-hmm.
So
That's certainly, there are ways that help. Absolutely. Those copay cards help, e-vouchers, things like that certainly do help. What happens when you have a 68-year-old patient on Medicare? Yeah, you're not going to be able to use one of those. So then it becomes a real issue. So absolutely. You're paying cash for an Eliquis or, a GLP-1 that, you're using it for type 2 diabetes, but if you can't afford it or you don't have insurance, I mean, that's thousands of dollars. And that's just a month. Mm-hmm. Yeah. Yeah, you look at the card this big and it's like, oh yeah, pay no more than $10 a month. And then there's this much fine print that, we don't read. And unfortunately, that's how they get it. So what can patients do to overcome these barriers? Simple things like Medisets, bubble packing, those things are certainly helpful. Having a good support system at home is very, very helpful. My wife, she gets on me when I don't take my meds. And so it's super helpful to have her around. Education and communication to really understand the importance of your medications. And then working with pharmacy teams to overcome those financial burdens, trying to find things like copay cards or just ways to get around that cost. Really, a lot of this comes down to communication. So for those of you who have been to previous AAPT conventions, you would have heard me speak on patient interviewing. So that's a real passion of mine as well, and talking and engaging with patients, asking those right questions, things like, when, if ever, have you missed a dose of your medications, and what do you do when that happens? How do you remember to take your medications? Yeah. Yep. Setting reminders on your phone, those types of things. Simple questions like that are really powerful, and they go a long, long way in helping your patient understand the importance of taking those meds. And so looking at a couple of the things that we have done on my team. So we've got a couple different programs, one looking at adherence just in general in partnership with our ACO. And so we currently have a team of pharmacists and some technicians that are reviewing patient data, looking for patients who are at risk or who are currently non-adherent with their medications. We're focusing on hypertension, diabetes, and statin usage. And then these patients, they get regular outreach. We do a lot of investigation into what is causing all of these non-adherent issues, whether it's financial concerns, it's access to the medications. I'm fortunate that I have an amazing team. of access coordinators that help a lot with this. So, absolutely, love having that resource there, but not all pharmacies have things like that. And so what do we do to really educate those patients? And it all comes down to that outreach and that engagement. We also have another patient program specifically focused on our HIV population. And so we are managing these patients to support adherence and access to medications, as well as some case management. And so again, like what we've already talked about, these medications are especially expensive. Lots of different things go into making sure that patients have access to these, that they're covered by some sort of grant funding or something like that. And so we have a team that is dedicated to working towards that. We get monthly touch points with each of these patients. We're coordinating refills with them, and it's shown some really great benefit. And so when we look at our adherence, and so we are specifically looking at a subset of Medicare for our Medicare star ratings. But in the period of August 2024 through March of 2025, we reviewed 1,968 prescriptions. And so when I say reviewed, we're going in and we're checking everything. Has the patient, what's their fill history look like? We're engaging with them. What side effects, are you having? Are there barriers to you not taking your medications, not receiving them, or having the access that you need? We intervened on 256 of these patients where we said, you know what, we've recognized that there is an issue here, and we have made some sort of recommendation to this patient. And you can see that 53% in that third column, that was our patient adherence rate before we did any intervention. So that falls right in line with that 50% mark that we talked about before. After our interventions, you can see that in the next three rows there, the number of prescriptions that were filled, not necessarily at my pharmacy, but just filled in general in the community for each of those specific disease states, and then our overall pass rates. And so in a relatively short period of time, we've gone from a 53% to about a 60% adherence rate. So certainly more work to be done, but it's a step in the right direction. And then when it comes to our HIV patient management, we have actively enrolled over 600 patients that we are following since November of last year. We have pharmacists and technicians on this team that work to perform necessary outreach. And then here's this PDC number. If you remember back, we talked about that 80% is that threshold of where we see that clinical benefit. And our patients are sitting at a 95% right now. So it works. And a lot of it really comes down to that outreach. And that's where that technician really plays a key role. And so we'll shift gears a little bit more and talk specifically about what the technician's role is in population health. So I found this quote when I was doing my research, and I thought it really kind of summarized everything. So by serving as trusted liaisons between healthcare providers and communities, pharmacy technicians play a pivotal role in improving health outcomes, fostering preventative care, and addressing healthcare disparities at the grassroots level. I think that's so true. You guys are on the front lines. You're the ones talking to patients. You're the ones engaging with them. You guys are truly the real deal when it comes to working with these patients and addressing their issues. And so when we look at specifically the technician's role, here's a whole bunch of stuff that technicians can do. Things like benefits investigations. Before a patient even comes in to pick up their prescription, how do we know what's going to be covered by an insurance? What financial barriers can we try to overcome before that patient even shows up? Again, performing that patient outreach, medication management support, adherence, access, all the things that we've talked about already. Case management, making sure that patients have the necessary means to support system and grants and all kinds of other things that go into making sure they have what they need to get their medications. Tracking and documenting data, again, going back to population health being very data-driven. Streamlining that prescription processing, making sure that patients are getting their medications on time every month, whether it's they're coming to pick it up. If they live out in the middle of nowhere, Nebraska, are we coordinating, sending this out in the mail to them? How are we going to get that medication to that patient? Working as a community health worker, providing patient advocacy and really being that voice for the patient. And then collaboration with the interdisciplinary team And then finally, medication reconciliation and getting that information that's necessary from that patient. And so one of the things that I did to finalize the rest of this presentation is I did actually an interview with one of our technicians who was on our Pop Health team. And I promise I did not coach her in any of these answers, but I think you'll see some common themes of some of the things that we have been talking about during this presentation. And so I'll go through each of these questions, with the first one being how is working on the Pop Health team helped expand your role as a technician? So working on this team has only continued to expand my role as a pharmacy technician, develop strong working relationships with the nursing and social work staff at our specialty care clinic, as well as Department of Health and Human Services, as many HIV patients are state funded or on copay assistance. I not only support medication adherence, but I also act as a liaison between patients, clinical staff, and DHHS to resolve barriers to medication access. It's given me a bigger picture understanding of how pharmacy fits into public health and allowed me to advocate more directly for patients, building trust and forming relationships that generally impact outcomes. So some of the things that I take out of there, developing strong working relationships, not only supporting medication, but being that liaison between the healthcare team and the patient, and advocating directly for patients and building that trust. Those are huge things when it comes to making sure our patients are able to continue their medications, continue to visit the pharmacy, and really trust us to take care of them. So what's your favorite part of working on the Pop Health team? So my favorite part is getting to be a consistent, trusted point of contact. I love that I get to problem solve, advocate, and am more embedded in public health goals like improving HIV viral suppression rates across the community. So again, we see that advocate word again come back out. Being able to problem solve. These are things that kind of shy away from the traditional technician role. Lots of challenges come into play when we're talking through patient adherence to medications, but really being able to take a challenge that a patient has and say, you know what, we have the resources, let's work with you to make sure this works. So what insights have you learned from working on the population health team? It's taught me that addressing medication access is only part of the equation, and that true patient care means understanding the why behind non-adherence. I think that's super, super important, understanding the why. That really gets you down to that root cause. I've gained insight into the complex social and emotional factors affecting the HIV population, from housing insecurity and mental health struggles to systemic stigma. It's allowed me to truly harness my powers of empathy, consistency, and clear communication. And it's shown me how collaborative team-based care, so pharmacists, social workers, case managers, and technicians can help close gaps that no one role could solve alone. And so we see the theme of interdisciplinary care coming forefront here. But we also see how those social determinants of health really, truly do play a factor in a patient's overall health outcomes. How is this role different from that of a traditional outpatient technician? So a lot of significant ways in which it's different. Outpatient technicians mainly focus on prescription processing, counting medications, managing inventory, and those things. My role on the comprehensive med management team is more patient-centered and more proactive. Working behind the scenes, I'm involved in outreach, troubleshooting insurance, and helping coordinate prior authorizations and grant or copay assistance. My role is less about workflow and more about impact. That, to me, is a pretty powerful statement. And then the last question here. So as trends continue to show the need and improvement of a focus on population health, how do you see a technician's role evolving and working on the overall team? So as the spotlight on population health grows, I see the pharmacy technician's role evolving into a vital connector between patients and the broader healthcare team. We're uniquely positioned to catch adherence issues early and streamline medication access. Instead of being behind the counter, we're stepping into more collaborative hands-on roles, coordinating assistance programs, following up on therapy gaps, and providing crucial support to the rest of the patient's care team. We're no longer just the middle step, we're a key part of the solution. To me, that if there's one thing that you guys take out of this whole presentation, it's that last line there. You guys are a key part of the solution when it comes to addressing healthcare issues, not just in population health, but in general when it comes to pharmacy and taking care of patients. Without you guys, my role would be infinitely more difficult. It probably wouldn't even exist. So shout out to you guys. So thank you for all that you do. So then in summary, so population health focuses on outcomes for a group of individuals with collective effort and goals to improve outcomes of communities. Guideline-directed medication therapy and adherence to med regimens are critical to the success of population health and supporting positive patient outcomes. And then pharmacy technicians play a vital role in the interdisciplinary team and are positioned to promote and support positive patient outcomes. And so with that, I did add my questions in here from the check your understanding for CE. So let's see if everyone was really paying attention. So question 1, which of the following are benefits to population health models? So lower healthcare costs, better health outcomes, patient engagement, improved transitions of care, or all the above? Absolutely. It's going to be pretty easy. Which of the following are considered social determinants of health? There you go. Yeah, I don't even need to read them. So estimates show that more than what percentage of patients are not adherent to their meds? 50%. Yeah. What's the standard threshold for proportion of days covered? 80. Perfect. See, you guys are paying attention. And then last but not least, which of the following are roles that a technician can perform on the population health team? Absolutely. And so with that, I will wrap up. If there's any questions or anything, please feel free. Yes. I did not. No, she was unable to come.
He did bring about.
Yeah. Cool. Yes. Yeah. Mhm.
Type of animal to get its health before they'll think about these their own animal.
Yeah.
And the same thing with animals very quick to learn that it's free time,
Mhm.
so they'll come find you next time.
Yeah.
We're gonna-
Oh, that's interesting. It makes sense though, right?